Obturator nerve, starting with the obturator nerve. Obturator nerve is a branch of anterior division of lumbar plexus, having root value of L2 to 4. So, as I mentioned earlier, obturator nerve, like femoral nerve, is a branch of lumbar plexus. But the femoral nerve arises from the posterior division of lumbar plexus, whereas obturator nerve arises from the anterior division of lumbar plexus. Root value is L2, L3, and L4. In this diagram, you can see here is the location of lumbar plexus, and here we have a branch arising from the anterior division of lumbar plexus, that is obturator nerve. Let's move on to the course of the obturator nerve. Okay, fine. So the course of obturator nerve is that after being given off by the lumbar plexus, it emerges from the medial aspect of the psoas major muscle. Then it passes posterior to the abdominal vessels, which are called common iliac artery. Here, in the midline, abdominal aorta divides into right and left common iliac arteries, which further divide into external iliac and internal iliac arteries. So, obturator nerve, during its course in the lower abdomen and pelvis, runs posterior to the common iliac arteries on both sides. So, further moving on, it crosses the pelvic brim. Now, what is pelvic brim? Here in this diagram, you can see the pelvic brim pointed out by the red line encircling in the pelvic cavity. This is the pelvic brim. How is it formed? It is formed in the midline posteriorly by the upper part of the sacrum, ala of the sacrum, then arcuate line and iliopubic line, finally the pecten pubis or the superior border of the superior ramus of the pubis. All of these structures together form the pelvic brim. Obturator nerve, as you can see in this diagram, passes or crosses this pelvic brim laterally by passing along the lateral wall of the pelvis and continues to run down to reach the obturator foramen, where it enters the obturator canal along with the obturator artery and vein. And soon after emerging through the obturator canal in the thigh, in the uppermost aspect of the thigh, it divides into its terminal branches, anterior branch and posterior branch here. This is the diagram showing a section of the pubic bone along with the obturator membrane covering the obturator foramen, and you can see within the obturator membrane here is the obturator canal through which obturator nerve and vessels exit the pelvic cavity to enter the region of thigh. This is the obturator membrane showing the covering the obturator foramen, and through it is a hole which is called obturator canal for the passage of the structures exiting the pelvic cavity to enter the thigh. And what are those structures? Those structures include obturator nerve and same named vessels. Here in this diagram, you can see obturator nerve. This is inguinal ligament extending from the anterior superior iliac spine, reaching till pubic tubercle. Look at the course of the obturator nerve. It crosses the lateral pelvic wall by crossing the pelvic brim to reach the upper part of the obturator foramen along with the membrane, so that it enters the obturator canal and finally leaves the pelvic cavity, enters the thorax. And here you can see soon after entering the thigh, sorry, I mentioned thorax, slip of tongue, it is basically the thigh. So obturator foramen, after leaving the obturator foramen, exiting the pelvic cavity, it enters the thigh and soon divides into two branches. This one is the anterior branch and this one is the posterior branch. This was all about the course of the obturator nerve. What about branches of the obturator nerve? Obturator nerve gives off two main branches, anterior and posterior, out of which this anterior branch is the largest as compared to the posterior branch, which is smaller. Anterior branch runs between the adductor brevis muscle. Here you can see in this diagram, this is adductor brevis, and adductor longus muscle. Here in this diagram, you see the cut sections of the adductor longus muscle. So practically, anterior branch of the obturator nerve runs between the adductor longus anteriorly and posteriorly adductor brevis, till it reaches the middle third of the medial aspect of the thigh, where it pierces the deep fascia of the thigh, which is called fascia lata, and becomes cutaneous in nature and further continues as the cutaneous branch. So anterior branch of the obturator nerve gives off motor branches and sensory branch. The motor branches include branches to adductor brevis, adductor longus. Occasionally, it may also supply pectineus and gracilis muscle. Whereas its sensory supply is to the skin over the medial aspect of the thigh till the region of the knee joint. Coming to the posterior branch, which we established earlier that it is a smaller branch as compared to the anterior branch of the obturator nerve. Posterior branch, after arising just below the obturator foramen, emerges after piercing the obturator externus muscle. Here, look in this diagram. This is obturator externus muscle shown in the supromedial part of the thigh. And here, small portion of posterior division you can see of the obturator nerve shown to be arising after piercing the obturator externus muscle. After which it runs vertically down on the adductor magnus muscle, running posterior to adductor brevis. Here in this diagram, you can see the small portion of the posterior branch from the obturator nerve shown to be passing behind or posterior to obturator brevis muscle on the adductor magnus muscle. Here you can see this adductor running on the adductor magnus muscle till it reaches the adductor hiatus, which was the gap between the two distal attachments of the two parts of the adductor magnus muscle. So, branches of the posterior division of obturator nerve include articular branches, which it soon gives off to the hip joint, and vascular branch in the region of the knee joint, to which it gives to the popliteal artery, and in another articular branch, which is actually the terminal branch of the posterior division of the obturator nerve, that follows or runs along the femoral artery through the adductor hiatus, running along the femoral artery, exits the anterior medial compartment of the thigh to reach the posterior aspect of the knee joint, which is the region of the popliteal fossa, where this terminal branch from the posterior division continues to pass into the joint cavity of the knee joint along with an artery, and that artery is middle genicular artery. So both these artery and terminal branch from the posterior division of the obturator nerve enter the joint capsule to enter the cavity of the knee joint. And this terminal branch supplies the knee joint. So this was all about the obturator nerve. So now let's move on to the obturator vessels. Starting with the obturator artery, origin. Obturator artery, if you look in this diagram, here is common iliac artery, which was a terminal branch of abdominal aorta. It further divides into two branches. Here, external iliac, which continues in the thigh behind the inguinal ligament as femoral artery, right? And here, another branch arising from the common iliac, which is the internal iliac artery. Internal iliac artery, when inshallah you will study in second year MBBS, abdomen pelvis, arteries in the abdomen pelvis, you will come to know that internal iliac is further divided into two divisions, anterior and posterior division. So, obturator artery arises from the anterior division of the internal iliac artery. Here you can see the obturator artery. All right, so the course or the origin of the obturator artery is, it is a branch of the anterior division of the internal iliac artery, and internal iliac artery itself is a branch of common iliac artery, which in turn itself is a branch of abdominal aorta. Now let's move on to the course of the obturator artery. Obturator artery runs anteroinferiorly along the lateral pelvic wall. Here you can see it is running on the lateral pelvic wall to reach the upper part of the obturator canal. It leaves the pelvic cavity to enter the thigh along with the obturator nerve and vein through the obturator canal. And soon after exiting the pelvic cavity, it divides into anterior and posterior branches. Here you can see below the obturator foramen, anterior branch and posterior branch, which are shown to be encircling around the external aspect of the obturator foramen by anastomosing with each other. Relations of the obturator artery in pelvis are very important, which Hanzala also asked during the lecture. What is the relation of the obturator nerve with the artery? So in pelvis, the relations of the obturator artery are such. Lateral to obturator artery lies the obturator fascia. What is obturator fascia? It is the deep fascia or the fascia lining the obturator internus muscle. Okay. You know that all the muscles are enclosed or lined by the fascia. So the fascia lining the obturator internus muscle is called obturator fascia, which lies lateral to the obturator artery. Whereas if you look in this diagram, obturator nerve, ureter, and in males, ductus deferens. All of these structures lie medial to obturator artery. Here you can see the obturator artery. This muscle that you see in the background is the obturator internus muscle, the fascia of which is called obturator fascia. It lies lateral to the artery, whereas this is ureter. It lies medial to the artery. Right? Here you can see, and here we have the obturator artery. And this is the ductus deferens, also called vas deferens. Right? Hope these pelvic relations are clear to you. So the branches of the obturator artery. There are a few branches from the obturator artery that are given off in the pelvis and outside the pelvis. So we divide the branches of the obturator artery into those given off in the pelvis and outside the pelvis. The branches given off by the obturator artery in the pelvis are iliac branches to the iliac bone and iliacus muscle, a vesical branch. Vesical refers to urinary bladder, so the branch is given off to the urinary bladder, and a pubic branch. Pubic branch runs along the pubic arch or the inferior border of the ischio-pubic ramus. Outside the pelvis, that is the region of the thigh, it gives off an anterior branch and a posterior branch. The anterior branch is a small artery that runs on the outer surface of the obturator membrane and supplies obturator externus muscle, pectineus, adductors, gracilis, and ends by anastomosing with the posterior branch of the obturator artery as well as medial femoral circumflex artery. The posterior branch of the obturator artery is also a small artery that runs over the inferior ischial ramus and ends by anastomosing with the anterior branch as well as anastomosis with the inferior gluteal artery. It supplies the muscles attached to the ischial tuberosity and gives off articular branch to the hip joint. And it is also it also gives off a branch. Here you can see in this diagram a very small branch arising from the posterior branch of the obturator artery given off to the ligamentum teres or the ligament of the head of femur, which supplies the small portion of the head of the femur. You must remember this fact because it has clinical importance, especially in the children as well as adults. This was all about the obturator artery. Moving on to the obturator vein. Here you can see we have obturator vein. Obturator vein can be single or can be multiple in numbers, right? And it has tributaries corresponding to the branches of the obturator artery. And After receiving tributaries corresponding to the branches of the obturator artery, it joins or it drains into the internal iliac vein and finally into the common iliac vein. Okay, beta, so this was all about the obturator vessels. This is the end of today's session.